Hello, friends, and welcome back to another episode of the Modern Pain Podcast. I'm fired up to be bringing you one of my favorite episode formats, which is interviewing lived experiencers of pain. If you've listened to this podcast, you know it drives me absolutely crazy when we continuously sit in circles of clinicians, academics, and researchers and make decisions on what people in pain should be doing. All of this without the one voice that should be present more than any, which is the voice of the person in pain themselves. As I've had the privilege of getting to talk to people who've went from suffering and fighting their pain to living well with pain, it has struck me on how little it often had to do with the hyper-technical interventional methods we were taught in school or on weekend courses, and more to just being a kind, supportive, present, and caring human. This week's guest, Trevor Barker, is another great example of someone living well with pain and giving back to help others struggling with pain to living well with pain themselves. Trevor spoke to his transition from the medical model, trying to fix and rid himself of pain, to taking a different approach and learning to live well with pain.
I've given them 20 years of my life and I haven't got a life. I might as well give this stuff a good red hot go and see what it does. And I might as well have a life with pain than be on the lounge room floor with hot water bottles doing nothing and still being in pain.
We spoke to medications for pain and how it impacted Trevor and the challenges he faced when he tried to move away from them.
It just keeps going up. And the intervention that doctors offer is to explore issues with tissues, as Joe Butler would say, put you into scans, pathology testing, pills, different pills, bigger pills. And you give that a go. And I gave it a go for a very long time. And I realised at some point that I was a zombie. I was using heavy amounts of opiates. I was sleeping a lot. I was numbed out. My brain was in a fog.
Trevor shared his decision to pursue doing things in life that he valued despite his pain not being completely gone.
And it was about time that I gave what I was learning in the program its best effort to see how that would work out, with the thought that I might have a life and I might still be in pain. At least I'll be doing a lot more than just lying around doing nothing and still being in pain.
If you have patients who are struggling with pain, this is a great episode to share with them. If you're listening, I would love if you could subscribe wherever you're listening to the podcast. If you're watching on YouTube, if you could subscribe and even throw a like on this video, it'll help us spread it to more people. I hope you enjoy the episode.
This is the Modern Pain Podcast with Mark Cardula.
Trevor, welcome to the podcast.
Oh, it's just great to be with you this morning, Mark.
I asked Trevor on, these are my favorite episodes to record because I think it's the most underrepresented voice that is in healthcare, and that's the voice of somebody who's walked the shoes of a person in pain and continues to walk the shoes of a person in pain and living well with pain. And I got to know Trevor's story a bit through Tom Bowen. He's been on the podcast. He runs a Facebook group, Chronic Pain Champions, I believe it's called. And I just saw Trevor really reaching out and helping some of these people who come into Tom's group who are struggling. And I find it fascinating to just lurk in Tom's group just to see how patients are helping each other. And I think it's such a powerful medium, people in pain helping other people who are struggling to find their way when they're having a life-changing experience where pain's starting to really limit their ability to live to the values they want to live towards. Before we get into some of the details of that, Trevor, I'd love, maybe you can share a little bit of where you're at, what you're up to, and maybe the story of where your pain journey started.
Where I'm at the moment is a bit of limbo land, in between jobs. I've been working for the last 3 or 4 years in prisons, supporting Aboriginal men particularly, to transition out of prison and back to community. And a lot of those people have trauma stories and a lot of them have chronic pain. And so it's been a special time for me just to be able to journey with them, to share a little bit of my story and to help them to make good plans for getting support when they come home. I'm also involved in Pain Revolution. That's a group led by Professor Lorimer Mosley. And each year they do a tour around a regional area of Australia. And one of the fascinating things for me is that Lorimer has understood that in regional and rural areas, access to the latest pain science and support for people to live well with their pain is very limited. And in one sense, that's a good thing because then they don't get access to the medicalised system of health that can really do a lot of harm. And I'll touch on that when I share a bit more of a story. But it's also not a good thing because there needs to be a big step up in terms of knowledge, but also an encouragement to people that are living with pain that there is a different road to take. And that road can make a big difference in how they live life. That's where I'm at the moment.
The pain revolution, when is exactly that? Does that come around what time of year?
It's coming up in about 4 weeks' time. Starts in Mount Gambier in South Australia and heads towards the Grampians and finishes up in Horsham. And for anyone that's in Australia that's interested, they can just go to Pain Revolution and see the different dates. But it's mid-September. It's not far away, and I'll be speaking at a couple of the venues and looking forward to catching up with the team.
It's an amazing event. I've just seen it from afar here in the States and seen some of the social media highlights and things, and have heard Lorimer talk about it in various kind of settings when he's been interviewed about it. And it sounds like an amazing event. And for those of you who are listening in Australia, we do definitely have some folks in Australia who listen. Make sure you check it out. We'll link it in the show notes so you can all take a look at when the dates are and maybe help your community or help some folks that rurally to get connected with some better information about pain, and that can hopefully change their journey. With your journey, Trevor, I'm wondering if you can recount a little bit. I know a bit from just seeing it and hearing you discuss it as you share some of your story with people that are struggling in some of the support groups I've seen you interact in. But I'm wondering for the audience, if you can maybe touch upon your journey as far as pain is concerned.
I'll go right back to probably 1977 when I injured my back at work. And I was carrying an extension ladder and it hit a beam in the roof. And I had to bend backwards to get it under the beam and then use my back to lift it back up. And about 3 days later, I was in a world of barely move. And I went off to the doctor. The doctor prescribed some pills and sent me to a physiotherapist who started working on core strength. And back then it was all about working with core strength. I recovered and went back to work, a couple of weeks after that, but had niggly back pain for many years. And then it progressively got worse. I coincided with a period of time in my life where I was under quite a lot of stress personally. So I was starting to have to deal with early childhood abuse and trauma, and work that I was getting on my back all focused on a medicalised approach to trying to investigate the cause of my pain. And in my mind, once they knew exactly what was going on, they'd be able to fix it with a pill or something. Now, I tried every sort of therapy. If they had therapy in the nameplate, I'd been there and visited. I'd have massage therapy, myotherapy, osteotherapy, physio, the whole lot. And even ended up having steroid injections in my spine. And that gave me a relief for about 3 or 4 months. And I had 3 of those. But the third one, I had a serious adverse outcome. My right leg felt like it was a big pot of Play-Doh and it went all rubbery on me. And I got off the treatment table and fell. And they immediately put me back on the treatment table and said, you better stay there for an hour. I did that, and then I had a support person with me to take me home. I had to walk to the car, and I fell walking upstairs on the way up and malfunctioned. And after that, I said, I'm never going to get one of those again. And in fact, they said to me, the gap in your disc is too small to do this again. And all the while that I was getting this treatment, my pain went from one spot through my back, into my neck, into my legs, into my feet. And I coined a bit of a joke with my massage therapist that I was seeing weekly for quite a few years. She'd ask me how I was, and I'd say the nose is okay today. I had a bit of a mindset that everything was a problem. In fact, I even coined a acronym for a new condition because I thought to myself, if it's well enough for surgeons to come up with their own syndrome, I might as well come up with one of my own. And I came up with 2. And because surgeons have failed low back surgery syndrome, and mine was TRMS, which was therapy resistant muscle syndrome, because I'd get a relief for a little while and then twang, the muscles would go back, and that's in my imagination, and I was in a world of pain again. And the second syndrome that I came up with was PMS, and I was absolutely the expert at PMS, which is poor me syndrome. Everything was a problem. And look, I've since learned that the way that we think and feel contributes to the intensity of our pain. So the more stressed we are, the more intense our pain is. So I got to the point where I was in serious pain. I was protecting myself. I was lying down with 2 or 3 hot water bottles on my back for hours a day, not moving, in the thought that if I moved, I'd be making my pain worse. And I did that for many years. And I got to a point where I had a conversation with a friend who was on large doses of opiate medication and extreme pain and dysfunction. And he told me about a pain management clinic. So I went off and enrolled in that course. It's a 3-week live-in course. And this time you go and visit them, you have a 4-hour assessment. And they go through everything, how you move. You have interviews with psychologists, occupational therapists, physiotherapists, doctors, and they establish what your baseline is. They even film me walking and talking about my situation. And I was getting down on myself at this time because I can barely touch my knees when I bend over. And at that time, I could only walk 100 meters without my calves just locking up on me. And I was really unable to move the remote. And in the middle of doing this assessment, the occupational therapist said to me, I want you to put your arms up and hold them up at shoulder height for as long as you can. And I had a bit of a smirk develop on my face, and I thought, so you. And so up they went. And 10 minutes later, he was looking at his stopwatch. He said, oh, listen, you've broken every land speed record we've got. You're not even breaking out in a sweat. And so we'll just pull up stumps and go on with the next thing. But what was going on in my head at the time was a bit of a reality check, really, that I could experience the fact that I could do something because I used my body in that particular way. And the reason I was able to do that is I've played the flute for 40 years at that stage. And so holding my arms up for a long time was just normal for me. And the message that sort of got into my head at that stage was, if you use your body, it can work. Started this 3-week live-in program where they taught us all about pain science, but they also, instead of just talking about it, you did it. So we started to change the way that we did life over that time. I got off my pain medication, and it took me 12 months to get off all of the medication. In fact, the last pill that I was taking was a antidepressant that was used for nerve pain in low doses, and it was working really well. I wasn't experiencing any nerve pain. And I thought to myself at the end of the day, why am I taking this pill? Let's see if this stuff that I'd learned would deal with my nerve. So I rang up the pain clinic and said, how do I come off these pills? What dose do I need to reduce? And do it slowly over a period of time. They gave me that information and I did it. And lo and behold, no nerve pain. And I was pretty pleased about that. Yeah. So I said at that stage when I started the program, I've given everything that the doctors had asked me to do my best effort. I've given them 20 years of my life and I haven't got a life. I might as well give this stuff a good red hot go and see what it does. And I might as well have a life with pain than be on the lounge room floor with hot water bottles doing nothing and still being in pain. And in fact, pain going from one point to all over my body, and being very sensitive to any exacerbation, any movement, any change would just trigger me off. So that's a bit about my story with pain. And after doing that program, one of the first things that I did was to go over to Perth, which is the other side of Australia, because my daughter lives there. And I had a granddaughter over there, and she had a family. And so I went over, and at this stage, I'd gone from walking 100 metres to being able to walk 10 kilometres. So that was a massive difference. So I was over there for about two weeks, and I was walking every day, and she was starting to notice the big difference. She went from protecting me. I was saying, "No, Dad, it's all right. I'll pick that up, or I'll do that," and being quite vigilant about making sure that I didn't hurt myself. And I still have friends today that have known me from a long time ago that are still protective in their way that they approach me, and making sure that I don't do too much. And this room is a indoor rainforest. I built it during COVID. In Victoria, the whole state was locked down for about 9 months and nobody could leave home. And so we built a room that has floor to ceiling plants. We've got a couple of ponds. We've got fish in here and frogs. And it's a very calm place for us to come and sit and just be with each other, have our friends around and be calm. And so life has changed a lot. Yeah.
I really appreciate you sharing that. It's an interesting story of definitely a major transformation you had for you. Some of the things that you mentioned, I'm curious was there a particular aha moment that you experienced, or was there something that, as you made this kind of journey to really get your life back, and like you said, might as well start living with pain versus laying around doing nothing with pain, were there any particular moments or people you encountered that really helped you make that shift that you feel were instrumental in it?
I think for me, coming to the realization that I'd given the medicalised approach its best effort, and it got me nowhere. In fact, it put me back in a really bad place. So for me, the aha moment was holding my arms up and just realising that I'd neglected every part of my body, not moved, but I'd still played the flute. And it was about time that I gave what I was learning in the program its best effort to see how that would work out, with the thought that I might have a life and I might still be in pain. At least I'll be doing a lot more than just lying around doing nothing and still being in pain. And what I discovered was that by getting a lot and getting active and doing things and doing meaningful things, I was able to do that without pain. I've got a shed just behind me that's a great woodworking space, and I started going and doing some woodworking, and I realised that I could be out in the shed for 2 or 3 hours doing woodworking and I don't have to whack myself because I hadn't felt any pain during that time. And that was an aha moment, really, that it was unheard of for me to go 2 minutes without pain, let alone 2 or 3 hours. And so things started to change for me. So I did the pain program in 2016 in September, and the pain revolution was coming to Albury. I didn't know anything about them at that stage, but when I did a little bit of reading, I discovered that this was a big thing. Professor Lorimer Mosley and David Butler and Tasha Stanton and a whole lot of really good people were coming to Albury, of all places, which is a smallish rural city. And that was my backyard. So I made contact with them and said, look, I don't mind reaching out to service providers in the community to engage them in coming along to this event. And they said, yeah, that'd be great. And I did my thing. So networking for me is like putting socks on. I'm really good at it. And so I started doing some networking, and I got about 160 people to 2 events, which was much more than any event that they had right through the tour. And I did such a good job of engaging the community that I was asked to come and work for them the following year. So I ended up touring Tasmania and doing a lot of speaking and getting involved. Something happened in Albury. Dave Butler got up and started to talk about dim sim therapy. And at that stage, dim sim therapy hadn't been incorporated into the Albury Wodonga assisting pain clinic that I'd done. So I'd done the program prior to them using dim sim therapy. And that fascinated me, that the idea that we can look at danger in me and perhaps ditch danger in me or change the narrative to be safety in me. So an example of that would be my set that kept me protecting my back and lying down with hot water bottles on it and not moving. I did that for 20 years. That was a danger in me. Not moving was, and it was making my pain just go from one spot to all over. So I changed that thought from move and you'll be in pain to moving is a good thing. And that became a sim. So I started to move, did a lot of hydrotherapy, getting in the water. That was very helpful to be able to experience moving, and the warmth and support that the water offered was a big thing. So I did that for a while. And then I started adopting dim sim therapy into my whole life. Simple stuff. Because I was protective of my back, everything in my house was on at bench level and quickly ran out of bench space. I wouldn't put stuff high or low, but then I started to change it up to put stuff down low and up high. It meant that moving and to get stuff out of the cupboards at the bottom became normal. So almost changing the built environment to support safe movement and seeing that movement was a good thing, not a danger. That made it big difference. Yeah.
There's David Butler and Lorimer's group, Noi Group, have Protectometer book, which the dim sim therapy is a really big hallmark of that book, where patients can work through it and clinicians can work through it with patients. I believe that book's still out there. I believe it's still in print, but I'm wondering if we could circle back to a little bit, because we have a lot of clinicians watching and probably some patients that tune in from time to time. The medication challenge, because you were able to look at that and say, hey, it's time for me. But I'm wondering, were there hesitations to get off meds? Because I see patients where that's almost just like a very dangerous security blanket to let go of, that they're just very fearful of the uncertainty of what might happen if they go off of these medications. Obviously you, and I've had a lot of other people that have gotten off them say, yeah, I was shocked to see how well it went. What were the challenges you faced, and what kind of helped you navigate your way off of the medications?
Oh, that's a very good question, Mark. See, when you go to the doctor in pain, they give you a pill and they say, come back in 2 weeks if you're still in pain. You come back in 2 weeks' time, they give you a bigger pill, and it just keeps going up. And the intervention that doctors offer is to explore issues with tissues, as Dave Butler would say, put you into scans, pathology testing, pills, different pills, bigger pills. And you give that a go, and I gave it a go for a very long time, and I realised at some point that I was a zombie. I was using heavy amounts of opiates. I was sleeping a lot. I was numbed out. My brain was in a fog. And the other side effect was that opiates do is they make you constipated and you get hemorrhoids. And so I needed an operation to deal with that. And I got to a point where those bigger pills just were killing me almost. Now, it's not to the extreme levels that I've seen. I worked as a pain coach for a while, and I had 2 people that stick in my mind. One that was in palliative care because of kidney failure due to the adverse effects of the medication that he was on. And another one who was applying for the disability support pension because he was going blind from the effects of long-term steroid use. Doctors don't necessarily explain the side effects, but we live with them. We experience them, but it's a slow burn. It's a bit like putting a a frog in a cold glass and slowly heating up the water, and they stay there. So as the medication slowly increase, the adverse effects start to kick in, and it takes a long time for people to realise that, hey, this medication road is not good. And I think having some curiosity about that, saying, what else is there? How can I deal with this? Because fallacy that doctors tend to make a lot of money out of is that, hey, they are going to find the root cause of my pain and they are going to fix it. Now, we have so many procedures out there, cutting out nerve, for example, spinal stents, spinal fusion surgery, all of this intervention designed to wipe out pain. And where you have at the back of all of that, failed low back surgery syndrome, because the failure hasn't fixed pain. So pain is far more complex than just issues with tissue. And what I got to learn and start to put into practice was there's not a whole, I had an interesting conversation with Dave Butler. I'll come back to that. Not a whole lot we can do with our tissues. That's what I would say. But I know I can do something about the psychological and the social drivers of existing pain. And Dave looked at me and said, hey, you deal with the psychological and social, and your body responds differently. It starts to heal, and your tissues start to perform differently. Now, that's my simple language. He had more scientific language around all of that. But the basic thing is, hey, there's actually a side effect to having good social and psychological well-being. And that is that the whole body's better for it. It takes time, but it's a different road, but it's a liberating road because you can start to reclaim your life. And that's what I discovered.
Pretty impressive, story. And David Butler, one of the giants in our field as far as pain science, has really had made some massive contributions along with him and Lorimer, Tasha, and all the groups over there doing some amazing work. You speak to the social components, which I think are greatly underestimated as far as that, but the psychosocial components have the context that we inhabit and the influences of our context of people and supportive relationships or stressful things that can really impact our biology, like David had mentioned. You spoke to how when you visited your daughter, there was this kind of initial, maybe prior to you making these big jumps and improving things, that family and even friends, it sounds like, were very protective of you. It's almost like a dim through them. I'm wondering if you can discuss that function of social contact for you and how maybe it transitioned from dim to sim, or how you could view it in that dim to sim framework when you have maybe well-meaning, loving family and friends. Of course, they care for us. They want us to be safe and things, but sometimes that can go to our detriment sometimes when maybe we're trying to navigate things into a more living well with pain and starting to become more supported self-management on my own versus people protecting me. I'm wondering if you could speak to that.
I think we're not meant to be alone. We're meant to be social. And if you think about the intensity of pain, that in-your-face pain, a significant part of that is stress. The more stressed we are, the more intense we are. And I mentioned that I had a few things going on in my life, and my wife's quite unwell at the moment. And in the last about week and a half ago, for the first time in 8 years, my back pain came back. And I was starting to get rather crippled by it. And I thought to myself, instead of what I do now is, instead of saying, hey, what have you done to your back? What have you lifted? First question is, what are you stressing about? And I took some anti-inflammatories for a couple of days just to calm that down a little bit. Started to move, got back into the pool, talked to my wife, calmed down a little bit, and lo and behold, no more pain, no more back pain. The social stuff, when we become isolated, we're left in our own thought, and we're left in that PMS world of everything's a problem. Whereas when we connect with other people and we get out and we have fun and we laugh, the endorphins get flowing, and we are in a far better place within our whole body and mind. I think that's the point of social, is being safe in our relationship. So I've got a bit of a story, if you don't mind, to tell about Dave Butler. And we're on tour around Tasmania, and we get down to Hobart to one of the venues, and Dave and Diane Wilson were talking at this event, and it was at an aged care centre. So if you can imagine being upstairs from an aged care home, and there's this big training room, and they filled it up with old people. And one of the beautiful things about Dave is he'll walk into a room and he'll just sit with it, and you can see his brain ticking over. He's discerning and picking up on the mood in the room, and then he gets very nervous and he's a bit jumpy, and he's starting to prepare what he's going to say. And my context at that point was that I'd been married for 30 years and ended up divorcing, and that was a sad, long story of pain. And I'd walked away from that marriage thinking to myself, that's it. I'm never going back into relationship. I'm done. It was just too painful. So Dave gets up and he starts to talk to this audience, which is 80% over 80. And he says to them, I want to talk to you about the pharmacy in our head. What pills are in our head that we release, and how do we do it? And so he asked that question, and he got to talk about endorphins and all sorts of good stuff going around our bodies and how our brain can release them. And he said something. He said, what do you think gets these happy juices going the best? And there was a bit of a pause, and then he yelled out, what about sex? And he threw his hands out. And all of these old people started nodding their heads. I told Dave this, but I'm sitting there trying to keep a straight face because of my own story of childhood abuse and stuff, and being confronted with that thought just smack in your face. Well, the other thing that was going around in my head was, that's not happening. And it changed my thoughts on the spot that maybe I need to think about getting back into the relationship. And the short story is that I did find a most amazing woman, and we came together and we got married. In fact, that tour happened in March, late March, when that story happened. We were married in October. So it happened very quickly. And we said to ourselves, Kay and I, we're going to have a kind, calm, loving life. And that's as simple as it gets. Hence, we're in this yarning room where we can sit and have a coffee and listen to the frogs and a lot and have a bit of a retreat and some quiet, calm time. But everything we do is centered around that. And we do a lot of things in the community with each other. We have a meaningful life. And that's really important part of our story of calming our nervous system, creating positive change in our lives. And the way that we do life really does matter. So we can greatly influence our pain state by how we do life and who we are.
A great example of the social components of pain, and leave it to David Butler. I just see some of his stuff. I've never met David personally. Hopefully I can get him one day to come on the podcast, but he's an amazing guy and definitely somebody I heard that has quite the sense of humor. Amazing story there. You've since, again, as I've gotten to know you a little bit online, just watching and lurking in the background in Tom's group, the Chronic Pain Champions group, I see you in there reaching and trying to help some people. A lot of times it's fascinating just to see some of those people really going through some difficult times and struggling. And I'm sure you're seeing maybe some of your past struggles in a lot of what you see. I'm wondering, what are some of the common things maybe you see with some of the people that are really struggling and are maybe earlier on in their journey where maybe you were prior to having the pain program and getting all this amazing support from some great folks. I wonder what is some of the big common things that folks are struggling with when it comes to, better able to get their lives back when it comes to some of these persistent pain issues.
Before I touch on that, I think one of the important things is that as a person with a lived experience, when I speak, people pay attention. Because they somehow understand at a heart level that this person has been through some of what I've been through. And I need to be respectful of that, but also understand that none of us really knows what's going on with another person. We can journey with them, we can listen to them, we can accept them. And the most important thing we can do is model to other people how we do life. And that's the challenge of, perhaps we could talk about a little later, about as clinicians, how do we model life? How can we bring along for the ride our patient and encourage them to model what we do? And when I went over to Perth, I've got a photo, I'll send it to you. But my granddaughter, who was probably 12 months old, 18 months old at the most, I've got my leg up on a block of concrete, stretching my calves before going for a walk. And I'm doing that, changing the other leg. And my own daughter picked up the camera and took a photo of her daughter doing exactly the same thing at that age. She was stretching her calves. Put your leg up like granddad. Now, that how we do life models to other people how to do it. And one of the things that the common theme for a lot of people in Tom's group is just reflective of what I've been talking about, the fact that we have a natural inclination to go back to the one question, what's going on in my body? What are the issues with my tissues? And then centering everything that we do around answering that question, which in my mind doesn't free us from pain, because we then go down the road of medication. There's lots of times people post, I've heard about this treatment. Who's had an experience with that treatment? Trying to find out whether a particular treatment is going to work for their condition. And so my response to that is to say, hey, we're asking the wrong questions here. And because if you're looking for an answer to your ongoing persisting pain, then you're not going to find it in that one nerve that's not working well, because the whole body is the nervous system. We have to calm our whole self down, not just go to that one thing and rip it out, which some surgeons do. They burn off the nerve, or they'll do a surgery, and lo and behold, the pain is still present. That's probably one of the biggest challenges within a group of people with a lived experience, is their natural inclination to latch on to what treatment is going to work for me. Yeah.
You've spoke to some of the things about being that example as a clinician of living the ways that we're trying to help patients to live. I'm wondering, besides that, what are some of if you could change one clinician behavior? I know there's many that need to be changed. I'm wondering, what are the one thing that if you could make clinicians really listen to, understand, and maybe help change their practice, what would that be?
Well, up behind me is Indigenous painting, and at the top of it is a word, Narana. Narana is an Aboriginal word which means to listen, to hear, and to understand. And the understanding is, once I've listened and heard, I show that I understand by what I do next. So talking about it is low-grade stuff. Doing it is what showing that you understand by what you do matters most. And so for anyone working with people with persisting pain, we need to listen. We need to sit with. We need to say, I'm going to fix you. I've had people tell me, in 6 weeks you'll be fixed. So we need that deep listening to not only hear what someone thinks about themselves and their situation, but what's behind that? What is their context? And context is such an important thing. There's a story that I'll tell you, Mark, about context. I've got a friend that's a pediatrician working at the best children's hospital in the world, the Royal Children's Hospital in Melbourne. And 30 years ago, she was in emergency, and this kid came hobbling into emergency, a severe limp. And so they started to triage this kid and go through all of their assessments, and they ended up running a whole lot of tests, blood tests, scans, MRI scans, the whole lot. Everything was thrown at this kid to try to understand what was the problem with his wobble. at the end of the day, when they ruled out every exotic disease known to man, they were starting to think, what else is going on to this kid? They called down the head pediatrician who came down, looked at the results, looked at the kid, and asked one question. And that question was, son, why are you limping? And the answer, because grandpa does. How's that? So it's very easy to make assumptions about what somebody's going through. I can do it in my work because I see a cohort of people, Aboriginal people in prison, and I could very easily write a script about what's going on in their life and what's their story. And I'd never go there. I say, hey, what's going on? Tell me about it.
What a great example of how healthcare loses the humanity of the situation. That's one of the things we've railed against time and time again as we get these folks that get sold into this diagnostic process where the person is a diagnosis. They don't say, well, what about the person who's experiencing these symptoms? It's just questions. Like that one seems like it would be so commonsensical. Why are you limping? And yet they didn't honor that unique and maybe opinions of the matter. And then next thing you know, that this which could have been easily dealt with a simple question right on the front end, and probably saved a lot of frustration on all ends of that, the equation, patient, healthcare person as well. Trevor, I could talk to you I want to respect your time. Really, we'll make sure we link some of the stuff you spoke to today, any social profiles or anything. If people want to touch base with you, where can they find you? Are you on any social medias or anything that people, if they want to reach out that maybe want to talk or contact you?
Look, I'm on Facebook. I think through Tom's group, you'll see my comments. People happy to message me. If we've got a few minutes, I'd love to touch on, which is
sure.
What can is modelling good practice to a clinic when my pain cleared up. It was timing. I just had to go. Said to me, "What are you called back for me?" We organised 4 weeks. I went to this clinic and I walked in, looked up and said, Trevor, well, didn't even know that I was Trevor, but I was booked in for that time. Got a welcome. There's a full range of sit down, have a cup of tea, sitting down, looking a whole pile of information about local groups, chess groups, walking groups, cooking groups, all of the social connectors for that community were up there. The way that I was treated, welcomed, and it's modelled away from the medical, what's wrong with your body, toward safe relationship, meaningful activities. Physiotherapy clinic at lunchtime for a walk to a cafe and sit down and have a coffee, connecting people to people, to safe movement, to quite enjoyable activities. They're the things that we can do in a clinic that model connect to each other. There's also a million things about our training, which says, don't be told, be clinic. And, when I was pain coaching, talking to people around the world, they saw this, and all of a sudden, the clinicians were moving away from the desk and putting plants behind them and pulling down their, sits in their university degrees and starting to lighten up and be warm and engaged. That's what we do. We can relationship building, but we do relationship with our staff, and the way that we do relationship with our patients needs to be consistent. So that's my encouragement.
Yeah, no, I think that equal expertise, right? And it's understanding you're sitting across the table or chair from an expert who's the patient, who knows their life, but also when somebody can see an empathetic, listening, caring, present individual in front of them versus the paternalistic talking down upon somebody, counters that might be healthcare. And you definitely see that in the folks that are working in persistent pain, and really folks with persistent pain. It's that whole validation, empathy, trying to establish that good relationship. It's a source of maybe a social relationship that provides some safety, and empathy and validation can be a powerful thing, people. Trevor, again, I want to thank you so much for your time today and joining me on a morning here in Australia. I also want to thank you for what you're doing. I think we need more Trevors and more Toms and more Keiths and Jolettas and Tinas and a lot of the folks we spoke to on the podcast who are lived experiencers who are sharing their experience. And I firmly believe that there's ways to do online communities and then also obviously in-person community. I think that's one thing we need in our clinics, like you said, is to get a community aspect to get people out into social worlds that can help support them and give them some of the things they can lean on to hopefully navigate some of the rough waters that sometimes their pain puts them in. So again, thank you so much, Trevor.
And thank you.